Namaskar. I would like to start by saying that I am very proud of the entire AIIMS family for the tremendous work that they have done during COVID-19. The work that has been done by every staff member of the All India Institute of Medical Sciences, New Delhi, during this pandemic and during the year 2020 has been appreciated by everyone in the country. The nation is proud of the work that the All India Institute of Medical Sciences, New Delhi has done, and it has led the way in how we can handle the pandemic and come out victorious as far as a pandemic of the magnitude that we saw in COVID-19 is concerned. Unfortunately, in this time of the pandemic, the Nurses Union has gone on a strike. 2020 is also being declared by the WHO as the year of the nurse and the midwife. And this is because this year we celebrate the 200th birth anniversary of Florence Nightingale, the lady with the lamp. Florence Nightingale is remembered for her work during the Crimean War, where she worked tirelessly to look after the soldiers who had suffered during that time. Today, in another war, we look at nurses to really work tirelessly to look after those who have suffered during this pandemic. What she had said at that time is that care of patients, irrespective of social class, disabilities, hygiene or occupation, is paramount for nurses. She had also insisted that a real nurse would never abandon her patients. And I'm sure that even in COVID-19, a real nurse will really never abandon her patients or those healthcare workers who are now admitted in our hospital and looking for care. The Nurses Union had actually put in 23 demands. Almost all of the demands have been met by the AIIMS administration and by the government. There is one demand which they have insisted upon, and this is basically a perceived anomaly in the fixation of the initial pay as far as the 6th CPC is concerned. We are currently having the 7th CPC which is being implemented. And multiple meetings have been held with the Nurses Union, with their representatives, not only by the AIIMS administration, but by the economic advisor in the Ministry of Health and Family Welfare, by representatives of the Department of Expenditure, and also by the person who drafted the 6th CPC. He was also present in the meeting. And he explained to the Nurses Union that the interpretation is not correct, and this is beyond the provision of the Gazette notification. But because the Nurses Union were asking for a hike in their salary, it was said by the government that they would sympathetically look at this as a fresh demand and ask the Department of Expenditure to consider this. It, however, seems inappropriate that when a country is fighting a pandemic, when we are fighting for our near and dear ones to save lives, and we know that we need to work only for a few more months and the vaccine may actually provide a solution. Unfortunately, at this point in time, the Nurses Union has gone on a strike. Also, at this time when the country is going through a lot of hardship, when people are having to accept pay cuts and a loss of their jobs, the Nurses Union is asking for a pay hike. It seems very, very inappropriate that this is something that is being done by the Nurses Union of a very prestigious institute like the All India Institute of Medical Sciences. In this time of the pandemic and during the year of the nurse and midwife, I appeal to all the nurses, all the nursing officers, not to go on strike and not to make us feel embarrassed about the dignity that we have as far as the nurses are concerned. I therefore appeal to all of you to come back and work and really help us get through this pandemic. Whatever issues you have, we will try and resolve amicably and try and be sympathetic to your demands. But at this time of hardship and this time of trial and tribulations, please do not go on strike. Thank you very much.